Hi everyone, thanks for joining us tonight. Tonight's webinar is about, we're going to look at where we fit, pet bereavement counsellors fit into the world of counselling. So tonight joining me on the panel, we've got Kirsty, Niall, Carrie and Lucy. If you've got any questions as we're going along, jot them down. Somebody will be keeping an eye on the questions that are coming in. And I would just like to, as I say, thank you for joining us tonight. The start tonight, we're not going to do a PowerPoint presentation or anything like that. There's no slides to watch. But what I am going to do is basically give my opinion, my own opinion of where we fit in. Now, that is not necessarily the opinion of the rest of the panel, but we'll hear from them. And it's not necessarily the opinion of the pet bereavement counsellors as an association. But basically what I would like to start with is just to sort of say, who did I learn about pet bereavement from? Well, I was very lucky that I learned my trade, if you like, from pet owners. They were the best teachers in the world because they told me what they wanted. They told me what they wanted. They told me when they wanted it. And it's from that I took all that information, all that learning, all that experience to, I guess, give my own interpretation of what a pet bereavement counsellor is. So from pet owners, what they have told me they wanted was they wanted basically a very informal chats. They wanted to access pet bereavement counsellors fairly quickly. When I think basically once they had made the decision that they wanted to speak to somebody, they didn't want to wait any length of time. They didn't want to approach, a lot of them don't want to approach their doctor. They don't want to approach counsellor psychotherapists for fear that they were going to be diagnosed, if you like, with some sort of mental health disorder. Now, grieving, as we know, is natural. Loss is something we all experience throughout our lives. And whilst everybody is different in how they cope with loss, the biggest problem in pet bereavement is disenfranchised grief, because a lot of the pet owners believe that they're not going to be taken seriously, and a lot of them, by the time they actually come to us, they have experienced it themselves. Now, that can be from friends and family, from work colleagues, it can even be from their doctor, it can be whatever counselling their doctor has referred them to. Now, that's not to say all counsellors are like that, just not everybody understands the devastating impact that the loss of a companion animal can have on someone. So they've also explained that they want that support given pre-euthanasia or pre the loss of an elderly pet. They're wanting the guidance and advice from someone who has experienced that before. They don't want to go and trouble their vet because they think their vet's too busy, or they feel embarrassed at going back and asking the vet or veterinary staff to explain the euthanasia process to them. They also look for support during euthanasia, for somebody to be there just for moral support, to guide them, to make sure that, they've got somebody with them if they were attending the euthanasia on their own. And then, of course, we have other clients, probably the majority of clients are looking for the support post-euthanasia. And the support post-euthanasia, they want to talk about their feelings, but most of all, they want to be heard. They want to be heard. They want to talk about their companion animal. They just want to know that what they are experiencing is perfectly normal. So they're looking for reassurance, they're looking for us to validate their loss. But further than that, they're not looking for anything else. They're certainly not looking to be sent home with homework. And generally, 1 or 2 sessions with a pet bereavement counsellor is sufficient. Now, I've been very lucky. Obviously, I've learned my trade, as I say, over the past 20 years, directly at source. Being a pet undertaker for many years helped with my knowledge and understanding of what people wanted. But I believe that pet bereavement counselling is a very specialist subject because it takes an awful lot of knowledge, not just of somebody's feelings and how they cope with bereavement and grief, but also our understanding of companion animals, their life expectancy, for example. What happens during a euthanasia? What exactly is it that the client is looking for during a euthanasia appointment that hasn't perhaps been explained to them? Pre-euthanasia, they want to know as well things about how can they prepare for it, not just when will they know when the time is right, but they also want to know how can they plan for it, how can they get back some control in their life. We are also, of course, support people whose pets are lost. So doesn't necessarily follow that all our clients' pets have actually died. It can be that their pets are missing. So we have to have an understanding of ambiguous loss. So with that speciality, a lot of the skills that we employ cannot be taught in any classroom. A lot of these skills that successful counsellors utilise, they are born with. It is natural. It is not anything that can be learned in a classroom, but obviously having the knowledge, the understanding, and the experience. And the experience, when I say experience now, I'm not just talking about experience of dealing with clients here. I'm talking about the experience of actually being in the position where you have lost a companion animal. Now, we can all, a lot of people say to me, I lost a companion animal, when the family dog died many years ago, and I didn't feel as badly affected. So what they want to know when they're speaking to us is that we truly understand what it is to lose a companion animal that was our sole companion, that we made every single decision for, including the euthanasia. So they can pick that up because anybody can sympathise with somebody's loss, but to actually be able to empathise, now that can come across very strongly. And if you're going to, make a difference to that client's life, you need to have that rapport with them. They need to know, and they can pick up very easily whether you're genuine in what you're saying, and you're not just going through the motions because you were taught to do that. So there is a lot of skills required. To me, I believe it is very much a specialist subject. And I guess that brings us round to where do we fit into the world of counselling? Well, for me, for over the years, it's not always been I've not always been welcomed. That pet bereavement counsellors shouldn't do the work that they're doing because we're not all qualified counsellors. Now, I don't believe that's true. And obviously, the success and the reputation that I have, I think speaks volumes in that regard. Because I was 25 years ago training to be a counsellor, and I decided that I would go down a different path and focus entirely on pet bereavement. So I firmly believe that we don't fit into the world of counselling, that we have, sorry, that's Georgie chipping a bit in there. What I believe is that we need to stand alone. one of the most common complaints that I get from clients is saying, I wish I had known about you X number of months ago. I wish I'd known about you before I went to the doctor. I wish I hadn't been suffering alone. I wish I hadn't isolated. So for pet bereavement counsellors, we need to fill the void between pet owners who lose their pet and they speak to family, friends. They might even speak to veterinary staff as well, who can be a fantastic support. Never underestimate the support that veterinary staff can give. But then if they need somebody to speak to, if they experience disenfranchised grief, the void between that and going to their doctor. Now, I'm not suggesting for 1 minute that we are somehow better than what a doctor can give, not at all suggesting that. But for a lot of clients, the majority of them will cope fine if they can get to speak to somebody who they feel they're being heard. Their voice is being heard, their story is being heard, and that quite often is sufficient. Now, clearly, if we will recognise if we believe that any client would benefit from going directly to their doctor or any other safeguarding policy that we believe that that client would benefit from. So there's, from that perspective, I'm not, trying to say don't go to the doctor if the client believes that would be the best route. But through raising awareness and education of what a pet bereavement counsellor can do, can actually help take a bit of the pressure off a lot of the counsellors that are out there, doctors, etc. And we can be there to help support them, to guide them, even if that is guiding them to their doctor, even if that is guiding them to a professional counsellor who, whatever therapies that they offer, we feel would be far more beneficial than what we can offer. And I have done that to several clients over the years, is to suggest that the rather than the therapy that I can offer, which is, listening, empathizing, reassuring, validating, and offering advice, that they may be better speaking to a qualified counsellor. So in that regard, that is why I think through the association, to raise awareness and educate the value of pet owners speaking to somebody who specialises and only specialises in this particular field is so beneficial. So that's my take on it. I know probably not everybody will agree with what I've said, but I'd like to put it out now to the panel to see what their thoughts on what I've said. And if anybody obviously has some questions that they want to ask, I'll just, I'm just checking the questions. Okay, so can I just go to the chat? I see that what about counsellors that don't have animals? I don't think they will truly understand. I think the pain of losing a companion animal is so unique. And when a human dies, everybody can relate to that. Everybody, friends, family, work colleagues, doctors, anybody that you are connected with in your life can all truly understand the pain related to the loss of a human. But with only 50% of the population, roughly, just slightly over 50%, 51%, I think it is, having a companion animal, it doesn't mean to say that the remainder of the population don't understand. A lot of counsellors, psychotherapists do have great empathy for someone. Just because they don't have an animal, they can still have great empathy and understanding for the loss. However, I think it is a very unique feeling to have made the decision to euthanize your companion, and the devastation that you feel after it, the guilt, the overwhelming feelings. So I don't know that they perhaps won't truly understand what it is. But I think to have lived through that experience is definitely puts the counsellor or pet bereavement specialist in a far better position to speak to a client who's going through that. So can I put this out? Who would any of my panel like to?
I will.
Niall.
Yeah, I would. I just on the thing about counsellors having animals. Very often, one of the first questions the client asks is, "Have you lost an animal? Have you been through this? Do you know what I'm talking about?" And to, you know, self-disclosure. Sorry, self-disclosure. Everyone's got ideas on how much you can, how much you can't. But I've not yet come across a single client when I say, yes, I have. And actually, the most recent loss was only 6 months ago, and it completely knocked me for six. My God, does that build rapport? Because they don't actually then want to know all about you, but it almost it's like exactly it validates what they're going through, and they'll open up because they trust you. They know that they know that you're there with them. Yes, it's your experience. Yes, it's their experience, but it's huge. It's absolutely huge to be able to say yes, genuinely. I have been there and I am still there, and again, one uses one's judgment. Some people ask a few more questions, and some people perhaps I would say a little bit more to than others, because it's all about building rapport and doing your best for your client and working with them in the best way that you can. But yes, I quite agree with Dawn. It's not to say that anyone that hasn't lost an animal wouldn't be empathetic, but when you actually have, and a client asks you that question, and you can be completely genuine, you're congruent with what they're feeling, you're congruent with their experience, and it goes miles. I have to say it, miles.
Carrie, have you got? Sorry, Niall, was that?
No. That's fine. Thank you.
Yeah, I agree with you, Dawn and Niall, and just thinking that on what Niall was just saying, that you could have like all the training in the world on every modality, but when I think the common sort of theme with like counselling and that is rapport and building that therapeutic relationship between, and congruence as well is a big thing, and being true to yourself and be there for the client. And I think that, as I said, you could have all the training on every modality there is in the world, but if you have a pet owner coming to you, and you can say, yes, I've lost pets too, even if it was recent or it's historic, the majority of clients that I've had discussions with, they don't care about necessarily about how many letters you have after your name, how many degrees you have, how many masters you have. They want to know that you know where they are and how they are feeling or how they felt. And it's not to say that we talk about, say, like self-disclosure, and it's a tricky one, because you have to be careful that you don't turn the attention to yourself. But some self-disclosure, if the client requests it, it's like, have you ever been through this? I've had clients in the past that have lost cats to RTAs, and I've said, unfortunately, I've lost a couple of my own cats to RTAs. And as soon as they realize that you've been through what they're going through, they don't, obviously grief is as individuals, a person experiencing it. So it isn't a case of, because I would never say to them, I know how you feel because I've been through it too. But what the client hears is, this person has an understanding, a lived experience of what I'm going through. And with regards to what Dawn had been saying, I think that it's collaboration, not competition. we're not working against counsellors that are trained and recognised by NCPS or BSCP or whoever.
Yeah.
We are working with you, alongside you. And, you know, you can have, and again, when Carolyn said about counsellors that don't have pets, you can still have empathy for the person who's experienced that loss. And you can understand the bond and the attachment and the severing of the bond and the effect that has. And you know, you'll do, you know, attachment theories and the like Warden's tasks of mourning and the dual process model. And so what we do isn't that far removed from what bereavement counsellors do, except that our clientele lost an animal, not a human. And so yeah, I think long story short, I agree with what Niall and Dom said. So that's me. So.
Thanks, Carrie. I think, yeah, you know, I think they, as well, they want to know that we have experienced the physical pain, that complete aching, that they feel their heart and their stomach has been ripped out the body, and that is a feeling like no other. And I've obviously, you know, yeah, when clients ask me, I had a client yesterday had asked me if I had lost a companion animal before. And one of the things that I have to be very careful of, and this may be something that with likes of, you know, somebody who has had multiple pets, I've got to be very careful that, you know, I'm not sort of saying, well, although it's common knowledge, I have lost over 25 dogs and cats of my own in the past sort of 10, 15 years, because it isn't a competition, but I still remember the feeling in the pit of my stomach, and how I felt and how isolated I felt when the first dog of mine died that I was solely responsible for. So it's a feeling that never leaves you. You remember that feeling for the rest of your life. So it's not just about the emotional feeling, it's also about the physical feeling as well. Kirsty, have you got something you would like to?
So I've been bouncing back and forth between the benefit is probably the wrong word of having the lived experience and not. So regarding Carolyn's question about what counsellors that don't have animals, I think if you are offering bereavement services for pets and you haven't lost your own animal, I think it is part of your duty to go out there and talk to people who have, and fully immerse yourself in how that affected people in, you know, emotionally, physically, mentally, in their well-being, in their daily life with their families. It is your responsibility to go out there and find that information. It's a lived experience, like Dawn said. You cannot replicate that feeling of absolute total numbness and loss, but you owe it to your clients to go out and find out as much of that information as you can by talking to other pet bereavement specialists, by talking to people who have lost pets, by talking to veterinary staff, by talking to charity staff, Blue Cross members, that sort of thing. They are all people who have lived or talked people through that experience, and I think you do owe it to your clientele to then go out and prepare yourself as much as you can.
Yeah, thanks for that, Kirsty. And I just wonder, yeah, so for sorry, I'm just going to check it's quite a lot, isn't it, to speak and try and read the chat all at the same time. I'm not used to this. Just as well I don't work in live television, isn't it? I would be going, sorry, what are you saying in my ear there? It's definitely needed. Yeah, thank you for that, Susan. Susan's comment, she completely agrees. She's a counsellor and feels the experience of pet loss is definitely needed. It's not really recognised in counselling generally. Now, thank you for that, Susan, because I think this is, you know, part of how I believe we can really all work together on this. So, you know, many of the pet bereavement, myself included, and many of the other pet bereavement counsellors, we have had some, occasionally, not very often, but occasionally we do get some negative feedback, generally from counsellor psychotherapists, saying, you know, you should be qualified to be doing this. And I've read some of the comments online as well when somebody speaks about a pet bereavement counsellor. But of course, the one thing that you don't tend to hear is us saying back to them, well, how much, if somebody comes to you pre-euthanasia, because they don't actually get clients pre the death or the loss when they are a bereavement counsellor. Whereas specialising in what we do, we will get clients who will come to us pre-euthanasia. So what do they know about, you know, the planning aspect? What do they know about if the client said, I don't want to, or, you know, I'm concerned about the euthanasia, you know, oh well, don't bother attending then. I mean, what's the answer? What do we say to them? Because no amount of talking about feelings is going to help. Yes, you can talk about somebody's fear, but fear to what? What is it they fear? Because we are then in a position to be able to explain the euthanasia procedure to them. We are also there to be able to explain what a peaceful ending it is, and the reasons behind making that decision. Also, you know, we take a lot of well, you know, obviously I'm speaking from myself, and I know my panel are absolutely all over the care and commitment that they give to their clients. But we also ask about their physical health. And with pre-euthanasia, for example, one of the first things we need to determine is, you know, how is their physical health? It's not just all about emotional health. So their physical health, are they being able to get a sleep at night? So Kirsty will, and I hope will pick up on this one and further explain. Somebody who, for example, is offering end-of-life palliative care, and that can be round the clock. Kirsty, can you give us some examples of some of you know, your clients that you speak to who are given round the clock palliative care? And these people, we have to remember that not everybody is in a big family unit who can, you know, mum does it one night, dad does it the next night, somebody else does it the night after. It can quite often be people who are living on their own and still having to go to work the next day. Kirsty, you'll know the sort of type of situation that I'm describing here.
Yeah, so it's something we see a lot in veterinary practice with oncology cases, some large like pinning ops and cruciate ops and things like that. Is the aftercare is just as big a deal as the actual treatment, and sometimes that has to be a discussion that you have in that consult at the start of, you know, you can treat this cancer, you can do radiotherapy, chemotherapy, everything else, but are you able to follow up? Is it safe for the household to do? Are you able to dedicate enough time? Because the guilt that comes along with that is paramount, is huge. People then blame themselves if they cannot provide that care and that level of detail that's needed post therapy, post patient care. And it is something that we see, it is a deciding factor. And I think that is hard for clients as well, because, you know, that is not illness that's causing that decision to be made. That is circumstance, your life choices. Do you have, you know, we see it all the time where people double medicate because, you know, Mrs. comes in, medicates, gets out, goes to work. Mr. gets up, comes in, medicates, and then you've got a whole other problem. I've actually done it myself. 3 weeks ago, I medicated my cat, and then my husband came in and did it. And that was a huge thing. She'd been through ridiculous amounts of recovery, and we were then faced with, well, now we've got possible liver failure, and all of these things build and build and build. And you do have to have that conversation of, are you prepared for this? Are you capable? Is it manageable? And if not, is euthanasia a better option? And I don't think that's something that can be provided if you're not living in this experience and offering this service for people, it's not something people are aware of, especially not if you haven't seen it before.
Exactly. It is a lot. And you know, it's funny because I actually spoke to somebody a few weeks back now, and we were actually talking about a French bulldog, and they had mentioned that the French bulldog was 8 years of age. Now, anybody who knows anything about dogs know that dogs generally live to be somewhere between sort of 12 and 14 years of age if they live a long, healthy life. So 7, 8 years of age isn't particularly old, unless, of course, you happen to know of the recent study, and I can't remember the gentleman's name. There were several of them did a study, a massive study on life expectancy and average age of certain or dog breeds. And the French bulldog average life expectancy is now 4.5 years of age. So if somebody then comes to you pre-euthanasia and they have a dilemma, do I, now we are not there to make the decision, but what we can do is we can talk through all the pros and cons of the dilemma that the person is faced with. For example, you know, we can talk through, is it better to go ahead with the surgery? Now, if somebody's past their average life expectancy, it might not be one of the better options. If that was, for example, a Jack Russell who was likely to live to 16, 17 years of age, yes, it would be perhaps a good option for them to go down. And as Kirsty said, the aftercare, post-operative aftercare, are they able to, you know, somebody living on their own, can they do that? Can they successfully do that, that level of aftercare required? We can also talk through, because euthanasia is a treatment. You know, it's not to say that you know, all is lost if that is, well, you know, if they decide they want to go for, you know, put their pet through the surgery, or if they want to just medicate, pain-killing medication, or if they want to go for euthanasia. So there are so many factors to consider, but you really need to be working right at the heart of this industry in various ways, whether it's like Kirsty, and keeping well up to speed with everything that's happening in the animal world.
Can I just go back to about us being a specialist and about us knowing this subject? Quite often, you know, I get a few sketchy notes about what's occurred before somebody comes on the line or onto Zoom or whatever. Sometimes more information than others, and sometimes they just don't know where to start. They just, I don't know what to say. I don't know, and you know, and probably perhaps frowned upon in the counselling world, because it's all about them telling you about how they feel, but sometimes people just can't. And I say to them, you know, I'm going to just stick my neck out here and I'm going to, shall I talk? Shall I talk for 2, 3, 4, 5 minutes? I said, and you just relax and you just tell me if anything resonates. And so I talk about perhaps how they might be feeling, or what's brought them to come to the appointment today, how they're perhaps feeling about the appointment, all of, you know, things which from my own experience, I've heard 100 times, hundreds of times. And I'm not saying that any of it's going to be right, but you can guarantee one point will probably hit. And I'll just say I'll stop now, because, you know, you've just, you know, gently introductions, and they'll go, how do you know? How do you know that that's how I feel?
Yeah.
And you hit the nail on the head. All of these sayings like you've got it in one, like you couldn't have put it. And again, it's part of the report, and it's part of then them being able to open up and actually start to talk, to tell the story, to not tell the story if they don't want to, but talk about how it's affected them. Sometimes I never know actually what's actually happened to the animal, what actually happened, because they don't want to go there, and that's fine. That's up to them. And we're led, if you like, by the client. But in that first instance, very often, I'm not leading the client, but I'm kind of giving them something to, one, to let them know that I'm on their page, but two, to, if you like, give them confidence to speak. And that comes, and I'm not saying it from a point of arrogance, but that comes from being a specialist in this subject.
You're 100% right, Niall, 100% right. And, as you were going through that, I was just thinking there was a lady that I had a client several years ago now, and I always remember this because she went, "Oh my goodness, Dawn, you're so intuitive. How did you know that?" And then 2 minutes later, she went, "Oh my goodness, you're so intuitive. How did you know that?" And then, and she went, "Dawn, I really think you're just a very intuitive person." And I was, I had that, that experience style that you're talking about. And yeah, I sort of smiled and I thought, well, it's a wee bit more than just being intuitive. It's having lived through it myself, and lived through it, on several occasions. But another aspect that I was sort of, I'm trying to stay on topic, but introduce as many different aspects as we can from the point of view of specialising. I'll just briefly tell this story as an example. I was in a vet's, popped into a vet's. I think I was handing in some leaflets, or I'd gone in for whatever it was. I can't remember the reason I was there. And I went over to reception, and it was a lovely young man that was on the reception. He gave me a lovely warm welcome, and he says, "Yes, how can I help you?" And I said, "Yeah." I said, I said, "Do you have any leaflets on the pet crematorium that you use?" And he went, "Oh God, is it dead? Is it dead?" And I went, "I beg your pardon?" And he said, "Well, is it dead yet? Because that'll depend on." And I went, "No, I'm just asking for some information on the pet crematorium that you use." And he went, "Oh, wait a wee minute." And he went under his desk and he came up with a piece of paper. Quite frankly, was in worse condition than this hanky, And he said, "Right, wait a minute. If it's dead, no. Now wait a minute. Is that communal? No, wait a minute. I don't know what that is. Do you want the ashes back?" No, he says, "Do you want its ashes back?" Now, that's just one example. And I believe, and this is why the one-to-one, the association ran the event down at Pet Funeral Services to show, to teach, just how important it is that we know all about that aspect, all the aftercare, all the different cremations, options that are available, roughly how much they cost, the process, the procedure, whether people are allowed to cremate, favourite cuddly toy or toys of the dogs, or their cat's favourite blanket, or whatever. Are they allowed to cremate these things? How does the process work? How are pets monitored throughout the process? So it's all that information, and clients will phone up and say, "I just wanted to ask you a question. I had one pet cremated at this crematorium and I got this much ash back, and I had my dog cremated at another crematorium and I get this much ash back. How can that be?" So being able to explain procedures, or even they talk about the colour of the ash. Why was ash white and the other ash was grey? Without that specialist knowledge, and that client just, it can be a very short phone call to reassure that client, just let them know what's wrong. So that's why I believe there is such a need for the work that we do. Now, obviously, I wouldn't be going and charging, but I'm sure none of us would be wanting to charge somebody just to tell them why one set of ash is dark grey and the other set is white. But it's having that level of knowledge that can help a client. Now, if they don't get that knowledge, the mind can take them off into all sorts of dark places, just over not having a simple explanation. And that is where our depth of knowledge and understanding and experience comes in. Now, I see my panel are all nodding away in agreement. Carrie, I wasn't sure if all the nodding in agreement was somebody was about to say something.
Oh, no, it's nodding in agreement.
It's agreement. Yeah.
Agreement.
I mean, it's definitely a very specialist subject in a niche area, and that's why I would prefer the term pet bereavement specialist myself, because it signifies a depth of knowledge on a very niche subject. I kind of shy away from the term pet bereavement counsellor because I'm afraid it will mislead people into thinking I have a recognised counselling qualification from a university. But pet bereavement specialist does signify an expert in depth knowledge on such a specific subject. So, and it covers everything, not just grief and loss, but as you were saying, Dawn, all kinds of different things, pre-euthanasia, palliative care and everything. So I think, I mean, I'm totally agreeing with you that it's a very niche area and it's a very specialist knowledge requiring a specific qualification, and it's a standalone profession in my opinion, basically. So kind of that sums up, I think, everybody, well, that's my opinion on it, at least. Yeah.
Yeah, no, thank you for that. I was just going to say there, in response to that I personally would prefer to be called a pet bereavement specialist. Like you, Lucy, I shy away from, well, right, okay. So if I say I shy away from from calling myself a pet bereavement counsellor, and then the first thing we say is we're pet bereavement counsellors, it sort of contradicts just what we've said. But for me, the only reason that, certainly from my point of view, and when we set up this association, that we decided to call it Association of Pet Bereavement Counsellors, is simply because the majority of people know what it means to counsel. So if you're being referred, and you said, oh, I'm a pet bereavement specialist, people go, oh, what's that? But if you say I'm a pet bereavement counsellor, they go, oh, all right, oh, are you? Straight away, people understand the name. So it's not that we are somehow trying to be unethical, or we are somehow trying to trick people into believing, that we are counsellors. Although the term to counsel is exactly what we do, is give advice, we help, we support people. So it is very difficult, but personally, I would rather call myself a pet bereavement specialist. Is this the time? Is the time right now? Bearing in mind how much the status of the family or the companion animal has changed in 20 years. 20 years, there was nothing out there virtually. 25 years ago, there was nothing out there with regard to support that was available for somebody whose companion animal died. Nowadays, it is out there. But I think, looking forward to the future, would this be the time that we started calling ourselves pet bereavement specialists, so that when we are actually putting out there the work that we do, that we're educating people from the get-go that we are pet bereavement specialists, which is slightly different, for example, from some of the qualified counsellors who have gone on to do additional study and training in pet bereavement, that they can then call themselves a pet bereavement counsellor, whereas we would call ourselves a pet bereavement specialist, which would almost you know, separate the two and show that in actual fact, right, you know, we may refer you to, so a pet bereavement specialist may refer you to your pet bereavement counsellor who has training in, you know, your anxiety. And gosh, we were talking, I think last week there about, or I was talking to somebody, I don't know if it was one of the panelists, about marriage guidance counselling. You know, that's not what we do, you know, but we can refer them to people who do that if that's what they are looking for. Because obviously quite often, you know, when a companion animal or a family animal dies, that there are rows within that family over the decision, over the euthanasia, over the aftercare, over what to do with the ashes. So, you know, and then how they're grieving, which obviously, you know, one will go silent and the other one's crying. And so rather than just describe, you know, the work of the incredible, well, I think he's incredible, Dr. Kenneth Doka, with his intuitive and instrumental grieving, that in actual fact, you know, we send them off for marriage guidance counselling. I would like to, sorry, I'm going to, Carrie, I know you're wanting to come in, Carrie, can I'm if you'd like to pick up from here, and I'm just going to read out a couple of the comments after. Were you going to come in there, Carrie? No?
Well, I can do, I suppose. I was just going to say, like, you know, I'm nodding because everything you said, I'm like, yes, yeah, this is brilliant. I was just thinking, I wonder if the concern maybe about us calling ourselves counsellors is whether there's maybe a concern that we aren't competent enough to understand our own competency. And I'd just like to reassure any counsellors out there that we are well aware of our competence and we work well within our competence. And we don't, I mean, I can't speak for anyone else, but I'm sure the degree that if we have a client that we feel needs something more than we know we're trained to handle, we will more than happily, you know, we'll be happy to refer to counsellors that are trained in other modalities, because there may be trauma involved with how the animal died. They may have witnessed it. I mean, many years ago when I worked in veterinary practice, we had a gentleman and his wife used to come in with two schnauzers, and they were unfortunately involved in a horrific car accident, and the wife and one of the dogs didn't survive the accident. And now this poor gentleman was left with the, you know, his remaining dog that was injured in the accident. So not only was he processing the accident, but also the loss of his dog and the loss of his wife, but also having then to live with this constant living reminder of who he'd lost and how. And so at the time, I wasn't qualified in pet bereavement counselling, but he did go to see his GP and have counselling. But I just think, you know, we work within our competency, and we can and we do refer on when we feel that we're out of our depth and it's gone beyond pet bereavement and there's other maybe unresolved grief from other losses, because sometimes pets are the last living link to a human loved one. And, you know, we are aware of what to look out for, and again with the association we have counsellors that are trained in other modalities that, like Dawn said, we can refer you to a pet bereavement counsellor, someone who is a counsellor but is also trained in pet bereavement, and they can help with trauma, or you know, maybe someone does EMDR or you know, regression or things like that. So, you know, as I said before, we're a collaboration. We're working with you, not against you. We're not trying to do more than we're qualified to do. We know what we're qualified to do and we do it well, but we also know our limits. However, as someone said, like in the chat, you know, I think it was Sandra said that a client of hers had been to see a licensed therapist in the States because their pet gone missing, and they just said make up a story and pretend that they're off on an adventure, and that'll make it okay. And that this client was in a right state when they got to Sandra. And so it's things like that, because you're a counsellor doesn't mean that you understand the sort of nuance with pet bereavement, but also as pet bereavement counsellors, we don't claim to understand all the nuances of anything outside of the pet bereavement experience. I don't know if I've overstepped there or, said, yeah, I don't know, but that's just my...
You explained it beautifully.
No, 100%, Carrie. And, I think, I don't know, what type of people that, that others think my clients are, for example. So I can only speak for what my clients, their occupations and what they have told me. Now, I mean, I obviously, when a client comes to me, all I need to know is their pet's name. That's the only information I need to have, is the name of their pet. I don't need any other information. I certainly don't need their home address, their date of birth, anything. All I need is the name of their pet. And from that, I will then, go on to support those people. Now, the number of, especially I would say over the past 5 years, the number of clients who have told me that they were a counsellor or a psychotherapist. Now, one in particular said that they didn't feel that their colleagues were qualified to counsel them, and therefore this particular person had come to me. Now, I don't know any of that information. I never ask anybody what they do, what their occupation is at all. If they offer that up, that's absolutely fine. It makes no difference to me. But I have noticed, and certainly I don't know about, that some of the other panel members here who have been, doing this type of work for a long time, but certainly for myself back, 2 decades ago, yes, it tended to be, people who I guess through word of mouth knew about me, would contact me for support. But over the past 10 years now, some of the clients that I have had, quite frankly, have shocked me, because we're talking very learned people here. These are not people that are, these are not people that are silly people. When we're talking about getting, for example, counsellors, psychotherapists, vets, doctors, very, very high-ranking civil servants, authors, people off television. I mean, and these people have told me what their profession is. I have never, ever asked anybody what their profession is. The only thing I have ever asked somebody is to tell me about their companion animal. And through that story, they have offered all that information up to me. So if counsellors and psychotherapists feel it's good enough to contact us, well, we're obviously doing something right. And I know certainly that some of the feedback now is certainly that's coming in is pretty good. For the work that we do, because people are starting to recognise that it, like you say, Lucy said, we all agree it's very niche, but we are, specialising in that niche area, because I think it's very important that, you have that level of knowledge.
The other thing is which really goes, I think, for any therapeutic relationship, you may well start it, but clients know very quickly whether they're in safe hands or not. And, if they don't feel they're in safe hands, they'll vote with their feet. And if they don't vote with their feet, you're probably going to end up doing it for them, because, you're going to see it's not going to work. But you know what? That's part of rapport building. And, and we mentioned congruence earlier, and genuineness. They know if they're in safe hands or not. They know where they feel safe, right, whatever you want to call it. And I think that, again, comes from maybe what they see of us before they meet us, with our profiles, etc., but also in those first few minutes, and letting them know that, you know what, we know what we're talking about. You know, it is niche, but you come to the right place. And as Carrie said, we don't go where we're not supposed to be. You know, we do have integrity. We've got our morals. We've got you know, our ethics, and you know, it's as simple as that.
Yep.
Can I just add something, Dawn? Sorry.
Yes, you can, Carrie.
So at the minute, I'm doing a level 5 pluralistic counselling diploma. So I'm going the other way. I'm going from pet bereavement to counselling. But I'm also doing a certificate in single session therapy. And on Tuesday, we had a section on, we were talking about, you know, what single session therapy is. So we're at the start. Anyway, there was a study done on 300 people asking what they want out of therapy. And out of 300 people, only 2% said they wanted to be listened to. They wanted to talk and be listened to. They wanted help. The majority wanted help with getting unstuck. Now, the reason I mention this is because I feel that where we can differ from counsellors in a way is that we can offer solutions and different perspectives and offer tools and techniques to move someone forwards, help them to get unstuck. So from what I gathered from this survey that was done was that you can reflect back all you like what someone is saying to you, and some of the counselling skills I'm learning, for instance, paraphrasing, summarising, reflecting, is all well and good. But with pet bereavement, somebody doesn't want, you know, if someone says, look, I'm devastated, you know, my cat died, they don't necessarily want someone to sit there and go, you're devastated, your cat died, I feel for you. They don't want, you know, they want someone to be like, I hear you and this is what we're going to do about it. They don't want someone to sort of say, this is how you're feeling, because they know how they're feeling. They want someone to know that you either felt that too, or, okay, this is what we're feeling, how we're going to deal with that. So I don't know if that fits in, but it just came to mind. I just found it really intriguing. The differences, but also a lot of similarities.
It is, you know, I think there are a lot of differences, and I think in a lot of ways we're all very similar. And I think on that note, I'm just looking to see that says, would you believe that was one of the quickest hours I think we've had? But that's time to wrap up. And you know, I think this conversation could you know, we could discuss it a lot more and discuss it at length. Maybe we could do it again another time. But I think, you know, whether we have another discussion or debate, or we put it out to a vote, do we start referring to ourselves as pet bereavement specialists, or do we carry on as pet bereavement counsellors? But either way, regardless of whether you're qualified counsellor, psychotherapist, or like me, just a pet bereavement counsellor or pet bereavement specialist. Thank you very much for joining us tonight. Thanks to my panel, to Kirsty, to Niall, to Carrie, and to Lucy. Thank you very much, everybody that's joined us online, and Sandra joining us from America. And if you're watching this on YouTube, if you can hit the subscribe button, please, just so that we can build up some sort of following on YouTube, it would be very much appreciated. Thanks very much, everybody. Look forward to the next webinar, and we'll post out details on the association Facebook page. Okay, folks, thanks very much.
Good night.
Good night.
Good night.
Bye.